Hello and welcome to Yinstill Reproductive Wellness, world leaders in complementary reproductive medical care since 2004. In vitro fertilization, frozen embryo transfer cycles, and acupuncture. Evidence and recommendations. This video is intended to teach you about acupuncture as a complementary therapy used to support in vitro fertilization and frozen embryo transfer cycles. It will summarize reported impacts on pregnancy outcomes and outline key recommendations for IVF and frozen embryo transfer cycle patients. Acupuncture has garnered significant attention as a complementary therapy for individuals undergoing assisted reproductive technologies, particularly IVF and frozen embryo transfer cycles. Many patients pursuing conception through IVF choose acupuncture to support them before, throughout, and after their treatment cycles. Research suggests that acupuncture stimulates the release of neurotransmitters that influence the HPO reproductive hormonal axis and regulate the nervous system. These effects support crucial aspects for IVF and frozen embryo transfer cycle success, such as enhancing blood flow to the reproductive organs, resulting in enhanced follicular development and optimized uterine lining and endometrial receptivity. Studies have shown that acupuncture significantly increased the chance of live birth by 32% and reduced the chance of miscarriage by about 43%. These findings suggest a significant benefit to incorporating acupuncture with IVF. Beyond its impact on pregnancy rates, studies show that acupuncture can be effective in reducing IVF-related anxiety. The emotional burden of infertility and the often stressful process of IVF can be significant, and acupuncture's calming effects may provide valuable support for patients navigating these challenges. Key recommendations for IVF and frozen embryo transfer cycle patients. Based on the current body of research, clear recommendations can be formulated for individuals considering acupuncture as part of their fertility journey, particularly when undergoing IVF or frozen embryo transfer cycles. Acupuncture dose and timing with IVF and frozen embryo transfer cycles. It is ideal for individuals considering acupuncture to support their IVF treatment or frozen embryo transfer cycle to begin weekly acupuncture sessions well in advance, ideally 2 to 3 months prior. This preparatory period allows time for acupuncture to address any underlying imbalances in the body, improve the quality of both eggs and sperm, and help regulate the menstrual cycle, improve blood circulation, and reduce stress, thus creating a more optimal physiological environment for the subsequent IVF or frozen embryo transfer cycle procedures. When preparing for an IVF, it is important to understand that the development of healthy eggs and sperm is a process that takes several months, and initiating acupuncture early provides an opportunity to positively influence their quality, as well as overall reproductive health. Continuing acupuncture treatments throughout the entire IVF or frozen embryo transfer cycle is also recommended. This includes sessions twice per week during the ovarian stimulation or frozen embryo estrase phase to improve follicular development, egg quality, and the uterine lining. Treatments before and after egg retrieval to manage any discomfort and support the uterine lining. 2 treatments within the 24-hour window before and after the embryo transfer procedure to promote relaxation and enhance implantation. And finally, continuing weekly acupuncture post-embryo transfer and throughout the first trimester of pregnancy. Each stage of the IVF or frozen embryo transfer cycle presents unique physiological and emotional demands, and tailoring acupuncture treatments to these specific phases can provide targeted and beneficial support. A comprehensive acupuncture treatment plan with a licensed acupuncturist who has experience in the field of fertility and IVF to determine a sufficient dose of acupuncture individualized to the patient is recommended. A special thank you to everyone involved in doing the research to better understand acupuncture and its impact on IVF. This important work supports informed clinical decisions for the practitioners and patients at Yinstill.